Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Gail lives in a small town, the kind of place where everyone knows her name at the grocery store. It's 6 p.m. on a Tuesday. Her 6-year-old has a spiking fever and a nasty cough. She managed to get them into the local clinic just before they closed. The doctor diagnoses her child with pneumonia and hands her a prescription for an antibiotic. But here's the catch. The only pharmacy in town shut its doors for good last month. Now, Gail is looking at an 80-mile round trip in the dark with a sick child in the back seat. And since rural pharmacies aren't usually open late, she may not even make it before the next town's pharmacy closes too. For many of the 60 million people living in rural America, this is the new reality. Today, we're talking about the critical, often overlooked role of the rural pharmacy and why their survival is literally a matter of life and death. To understand where we are, we have to look at how the local druggist evolved. For decades, the community pharmacy was just a place to get a bottle of pills. But over the last few years, that's completely changed. Today, these pharmacies are clinical hubs. They handle vaccinations, point of care, lab testing, and help manage chronic diseases like diabetes or heart disease. In fact, patients visit their community pharmacist nearly twice as often as they see their primary care doctor. In some areas, pharmacists are the only qualified healthcare professionals for miles. During the COVID-19 pandemic, they were the ones on the front lines, delivering over 50% of the country's vaccinations. But while their role grew, their safety net started to fray. Back in 2006, the implementation of Medicare Part D changed the game, often resulting in lower reimbursement rates for independent pharmacies. Then came the rise of pharmacy benefit managers, or PMBs. These middlemen often steer patients toward their own big chain or mail-order pharmacies, sometimes reimbursing local independent shops less than what it actually costs to buy the medicine. While big chains like CVS or Walgreens dominate the cities in the US, access in rural areas relies almost entirely on independent and franchise pharmacies. In rural counties, over 76% of pharmacies are independently owned. When these rural pharmacies close, they don't just leave a gap in healthcare. One pharmacy owner called their store the crux of the community. When these stores close, town sales tax revenues can drop by as much as 15%. It even makes it harder for other local businesses to hire people. Because who wants to move to a town where you can't get a prescription filled for 40 miles? And for the staff left behind, when one pharmacy closes, the remaining ones are slammed with new patients, leading to longer wait times, staff burnout, and a fear of making mistakes because they're just too busy. So at this point, we usually have a guest on Mapping Healthcare who I interview. But today, we're going to take a slight detour that will give you some context about who you'll hear from. Last month, I was one of 9 students at the Transom Story Workshop on Catalina Island. It's about an hour by ferry from mainland California. Each of us created a short audio story about someone living on the island. My piece was about Sue Ponce, who is the sole pharmacist on Catalina Island's only drugstore for almost 3 decades. You'll hear my piece in a bit, but first I want to tell you a little bit about my experience at the workshop. This segment is titled Vox Populi, or How I Learned to Stop Worrying and Talk to Strangers. I'm going to start with a confession. I am quite comfortable talking into a microphone. I am much less comfortable talking to strangers and then pointing a microphone at them. Which brings me to Vox Populi. Vox pop, as the cool folks in audio say, comes from the Latin vox populi, the voice of the people. In audio storytelling and journalism, it means you ask the same question to a whole bunch of random people, usually strangers, and then stitch their answers together so we get a chorus of voices instead of just one opinion. It's basically crowdsourced humanity in sound form. At the Transom Audio Storytelling Workshop I attended, we were told very casually by the instructor, "Okay, we're going outside now. You're going to stop 3 strangers and record vox pops." My friends, I was terrified. Plus, as you'll figure out, I was just recovering from laryngitis, so my voice was weak and raspy. My brain right away offered an unhelpful list of worst-case scenarios. Everyone ignores me because they think I'm weird. People stare suspiciously at me, a brown woman with a scratchy voice asking them questions. Someone calls the police. Someone asks, "Who do you think you are?" Which is a question I was not prepared for right then at this point in the workshop, since I was deeply inflicted with an existential crisis. But because this was a workshop and I wanted to be an A student, I went anyway. We were each supposed to ask strangers on the streets of downtown Avalon and Catalina Island one simple question. So I chose, if you were stuck on a desert island, what 3 things would you take with you? A classic question, familiar, it's low stakes, what could possibly go wrong? Turns out, nothing. People love this question.
All right, testing. I think this is recording now. What is your name?
Brandy.
Brandy. Hi, Brandy. I'm a student in an audio storytelling workshop on Catalina Island. I want to ask you a question. If you were stranded on a desert island, what 3 things would you take with you?
Well, I'm pretty practical, so I would say water, probably a good book, and a way to make fire.
Ooh, okay. That good list there, Brandy. Thank you so much.
I know the water would obviously go quickly, but you got to start yourself off with success.
Yeah, for sure. Well, thank you so much for your time, Brandy. Enjoy the rest of your day. You're a cute baby.
Thank you.
Hi there. I'm a student in a podcasting workshop that's being held on Catalina Island this week. And we have this is for a student project. We're supposed to go out and talk to a random stranger and ask them a question. My question is, if you were stranded on a desert island, what 3 things would you take with you?
Water, water, and water.
On an island? That's true. Yeah. And why is that?
Because that's what you need to survive.
All right. Good plan. Thank you so much. And what's your name?
Good luck, Carrie.
Carrie. Thank you, Carrie. Bye. Hi there. I'm a student at the Transom Audio Podcasting Workshop on Catalina Island this week. And we're supposed to, this morning's exercise, to go out and speak to 3 random strangers and ask them a question. Okay. And my question is, if you were stranded on a desert island, what 3 things would you take with you?
My dog, food and water.
All right. That's good. And how old is your dog?
5.
And what's your dog's name?
Zoe.
Zoe, and what's your name?
I'm Leslie.
All right. Thank you, Leslie, for your time. So I'm here with Leslie, and Leslie works at Diving Catalina.
And the kelp forest.
And the kelp
The
forest.
kelp forest,
All
yeah.
right. Great. Thank you so much. So you're local on Catalina? Thank you so much for your time. Bye. All right. My name's Ulfat, and I'm a student at an audio workshop here on Catalina Island this week. And we're supposed to go out and ask random strangers a question. And my question is, if you were stuck on a desert island, what 3 things would you take with you?
I don't really know. I guess my wife, my son, and a helicopter to get off. I don't know.
All right. So family man, that's also very
Cheating.
practical.
Yeah.
That's good. All right. Great. And what's your name?
Sam.
Sam. Thank you so much, Sam. Enjoy your day. I'm a student at an audio workshop here on Catalina Island. We're doing a student project where we just go up to a random stranger and ask a question. Oh, yeah. It's for the student project. So is that okay if I ask you?
Absolutely, yeah.
All right. So what's your name?
My name is Sienna.
Hi, Sienna. So my question for you is, if you were stranded on a desert island, what 3 things would you take with you?
Oh, this is tricky. I bet this is so Gen Z of me, but I have to say my cell phone to keep me entertained. The second thing would be, shoot, this is so tricky. I would just say some chocolate. If I can have a limited supply of chocolate. Chocolate is my favorite snack. I would say chocolate just to keep me entertained. And then I would say, I've been meaning to read the book. Like, there's a book about the Oh my gosh, what's it called? Is it called like The Last American? I forget. The book.
What's it about?
The book that inspired the movie that brought the bison to the island. I've been meaning to read that for so long.
I haven't heard of that.
Yes, I forget what it's called. I almost want to look it up because
Oh, yeah,
I
you
forget
can
what
look
it's
it up.
called.
That's fine.
Yes. Yes, let me see. I've been meaning to read this book and I can't get away from my phone to read it. So I'm like, I don't know what it's called. Shoot, I can't find it. Okay, I don't know. I'm so bad at this. But whatever
so
that
the
movie
book
is.
about the bisons on Catalina
Yes,
Island.
exactly. Yeah,
Okay.
a book, chocolate, and then my phone to keep me company. I'm sure I'd need water and food and stuff like that, but that's I don't have to worry about all that. I'm sure I could forage for it.
Yeah. Those are some nice practical things to take along.
Yes.
Thank you so much for your time. I appreciate it. And you're here at the mini golf Catalina Island. Thank you so much for your time.
Of course. Have a
Bye.
wonderful day.
Yeah, you too.
The first person I approached, a woman in workout clothes with a baby stroller, didn't run away. She smiled at me and she thought about it and then she answered. So once that first answer was in the can, something shifted. Asking the second person became easier. And the third person was actually fun. By the fourth or fifth, so yes, I went beyond the 3 required vox pops. I was thinking, am I becoming one of those people who enjoys talking to strangers? Here's the thing about vox pops. People genuinely like being asked what they think, especially about playful, imaginative, what-if questions. You're inviting them into a moment where they get to think outside the box. And the answers? Some people went practical. Water, food, a way to make fire. Some went emotional. My dog, my wife, chocolate. So let's pause for a quick public service announcement. If you are actually stuck on a desert island, like not the vibey Instagram version, but the survival version, experts agree your priorities are boring but important. Clean water or a way to purify it, a cutting tool, fire starting capability, a way to signal for rescue. Not your wife, and unfortunately not a book about bison. I looked at the book Sienna wanted to read, and it's called The Vanishing American by Zane Grey. I plan to check it out. But that's not the point of a vox pop. The point is in correctness, its character. In just a few seconds of audio, you learn so much. Who thinks practically? Who thinks emotionally? And when you string those voices together, something pretty cool happens. You hear how diverse, creative, and human our thinking really is. By the end of the vox pop exercise, the thing I feared most, approaching random strangers on the street, ended up being the easiest part. I wasn't performing, I wasn't explaining. I was just asking one question with curiosity and then getting out of the way. That's the power of vox pop. You stop being the storyteller and you become the listener. And at the end of the exercise, that mic felt a lot lighter once I realized I didn't have to carry the story alone. The people did it for me. I usually go to a bunch of meetings with clinicians, so this was something totally different for me. Transom is a nonprofit dedicated to fostering the art of audio storytelling. It's a great resource for audio producers, journalists, and beginners in public radio and podcasting. When I showed up to the Transom workshop a couple of weeks ago, I thought I was going to learn some audio technical skills. Better interviewing, cleaner recordings, a few narrative tips I could use on this podcast. What I didn't expect was to completely rethink how stories work, how listening works, and what all of that has to do with healthcare. For a week, I was a student again, not a physician with a pager, but someone sitting with an eclectic group of students, among them an LA scriptwriter, an audio artist from rural Oregon, a spoken word poet from Atlanta, learning how to listen. I realized that audio storytelling has a lot to teach healthcare. At Transom, one of the first things I learned is that audio is intimate. There are no fancy slides with graphics. There's just a voice, literally in your head. When your listener puts on their headphones or turns on their podcast in their car on their way to work, you're suddenly very close to them. That changed how I thought about storytelling, and it also changed what I thought about patient encounters. In healthcare, we rely on voices, tone, pauses, what someone says and what they leave out. Audio storytelling trains you to notice all of that. Another lesson: stories sometimes don't start where you think they will. As a clinician, I can tell you that patients rarely start their story at the clinically relevant part. So audio storytelling teaches patience. You learn to wait for the real story to reveal itself. And then there's editing. In audio storytelling, editing isn't about making someone sound smart or smooth. It's about clarity. It's about not manipulating the listener and not editing out the person behind the story. That responsibility felt familiar. As physicians, we edit patient stories all the time into notes, summaries, hospital discharge instructions. The question audio storytelling asks is, what are you leaving out and why? So why does audio storytelling matter in healthcare? Because healthcare is full of stories. Stories of illness, resilience, uncertainty. But too often, those stories are reduced to data points. Audio allows patients and clinicians to be heard as whole people. Being a student on Catalina Island, learning something I'm a relative novice at, reminded me what being vulnerable feels like and what it's like to sit with feedback instead of giving it. So I left the Transom workshop with new technical skills, yes. But more than that, I left with a renewed respect for the human voice and an appreciation for story. So here's my story of a rural pharmacy and its pharmacist. The tiny pharmacy has a view of the ocean from its front door. A sign on the window says, Dramamine motion sickness relief sold here. It's next to tourist souvenirs, a water bottle that says, I'd rather be a mermaid, a mug that claims life is better in flip-flops. Leo's drugstore on Catalina Island, California is nothing flashy, but it's one of those places where people don't just come in, grab what they need, and leave.
Basically, you have a lot of more one-on-one interaction with your patients. They're your neighbors, your friends, your family. They see you on the street. They approach you sometime and ask you questions. You know, sometimes the boundaries get a little blurred between work and not work.
In a big city, a pharmacist can feel anonymous. On an island of 4,000 people, it's personal. People know Sue Ponce, and she knows them. Sue was the pharmacist at Leo's. She retired a year and a half ago. Today, she shows me her routine for the 28 years she was Catalina Island's only pharmacist. In a pharmacy the size of a walk-in closet, there are orders to check, deliveries to track, and patients to talk to. And frequently, her role stretched even further. Without easy access to a primary care doctor, people sometimes turn to the pharmacist first for advice, for reassurance, for help deciding what to do next.
A lot of times for people, they come to me before they try to go to the clinic because sometimes they can't get in the clinic.
If you've lived in a small town, you know, community isn't just something people talk about. It's a feeling, the way people have your back. On Catalina Island, that feeling runs deeper because when you're surrounded by water, you learn to rely on each other.
I'm their only, quasi-medical provider that they can see right away. But also, you have the same patients that you're seeing on a regular basis, and you feel the same things for them on a regular basis. So you get to know them and know their issues.
If you ask around, people will tell you that Sue is not just a familiar face. She's a trusted confidant, someone they count on. On an island, I see the distance, but what stands out more is the connection. For example, one time a girl and her parents came to the island, and the girl had recently been diagnosed with diabetes.
And she had forgotten her insulin. And I was actually off work. And they saw me on the street, and they told me what happened. And I said, okay. So I went back in the pharmacy and found out what they were needing and took care of it and got her insulin that she needed.
Back at Leo's drugstore, a woman with a baby comes in to pick up some medicine. Another woman asks if she should worry about her rash. Turns out she just needs some reassurance. And that's part of the job. Because on an island, healthcare happens through relationships.
I used to live up the street from here, where we are right now, and I was outside of my house and somebody stopped in their golf cart and started asking me a bunch of questions. I mean, I used to get questions all the time, even when I wasn't working.
On an island, everything, medications, supplies, need to come from somewhere else. And sometimes they don't get there on time.
Weather is a real concern over here. When the weather is bad, especially if it's foggy over here and they can't fly. I've had times where I've had 5 days with no drug delivery.
When that happens, pharmacists are resourceful and find ways to get people the care they need.
If it's a drug that's got two different things and you don't have that, but you have each individual item and things like that, you just have to get creative.
When the exact medication isn't available, pharmacists sometimes have to get creative, carefully compounding or adapting what they do have. There are moments when the pressure builds, a prescription that's late, a patient who can't wait, situations where there's no easy solution.
And then they would expect that you could, provide miracles to them.
4,000 people live on Catalina Island, but its population doubles every time a cruise ship pulls in.
The people that come off the cruise ship sometimes, I forgot my white pill and we're like, okay, what's the name of it? I don't know. Well, I'm sorry, I can't help you if you don't know the name of it. People would be very angry and upset and sometimes use bad language.
And not all of the challenges are visible. Insurance that won't cover a medication, prices that put it out of reach, times when the question isn't just what someone needs, but what they can afford.
Trying to navigate, prior authorizations, phone calls to insurance companies, phone calls to doctors. It took up quite a bit of time from other aspects just to make sure that people got things that they needed.
And then there's the reality of keeping the doors open. Small pharmacies like Leo's are getting harder to sustain. Margins are thin, so the shelves don't just hold medicine. There are snacks, seasonal items, souvenirs. Those things are necessary to keep a place like this open.
A couple of those bosses, they knew that the pharmacy was not making the money, but that was important to them for the town, kind of, to benefit the town, that the drugstore stayed viable.
Spend a little time on an island and you'll start to see it too. This story isn't just about one pharmacist doing her job. It's about how people in a community watch out for and take care of one another. One conversation at a time, one small act of trust at a time.
I would be in a group of people and they would say, oh, that's our pharmacist. She takes care of us. And that was pretty cool to feel that love back from the community.
Lauren Reinhardt has taken over as the new pharmacist. Now, Sue Ponce is on the other side of the counter at Leo's. When I met up with Sue this week on Catalina Island, she had recently cruised into retirement. Literally. She and her husband just got back from a cruise to the Caribbean. She's back to Catalina to plan her next voyage. I guess you can take a girl out of the island, but you can't take the island out of a girl. This is Dr. Ulfat Sheikh for the Transom Story Workshop on Catalina Island. On my ferry back from the workshop, I thought about what's being done to try to keep pharmacies open for communities that need them the most. Some policy experts are pushing for a critical access pharmacy designation, like what some rural hospitals have, to provide financial protection for these essential pharmacies. Others are looking at ways to help new pharmacists deal with their student debt that often deters them from opening a store in a small town where salaries are lower. So as we wrap up, what should we take away? First, rural health depends on independent pharmacy sustainability. Policymakers talk about pharmacy deserts in cities. That's being 10 or more miles away from the nearest pharmacy. 10 miles doesn't sound like a huge problem if you have a reliable car and a free afternoon. But 10 miles is a real barrier if you rely on a bus system that doesn't run on weekends, or if you're elderly or recovering from surgery. Protecting rural pharmacies isn't just about business. It's about making sure your zip code doesn't determine your survival. Second, pharmacists are clinicians who are experts in medications. In the United States, counties with a low density of primary care physicians are 30% more likely to contain pharmacy deserts. So the areas losing their pharmacies are the exact same areas where patients already can't get a doctor's appointment. If we want to reduce the impact of the impending physician shortage, we have to let pharmacists practice to the full extent of their training. And finally, the loss of a pharmacy is an economic and social crisis. When the local drugstore vanishes, it takes away tax revenue, jobs, and a trusted health partner who knows your family history. We need to see these pharmacies as anchors of rural life that are worth saving. So the next time you pass by your local pharmacy, think about the fact that for a parent with a sick kid at 6 p.m., that isn't just a store, it's a lifeline. Thanks for tuning in. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM. Connect with the show on Instagram at Mapping Healthcare to share your thoughts and ideas for future episodes. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.